It's my pleasure to discuss negative pressure wound therapy induces lymphangiogenesis in diabetic wound healing. This exciting paper out of Harvard by Wu and Liu as primary authors with several Chinese collaborators represents an important step in improving chronic wound healing. Diabetic wounds are wounds which occur often on the extremity, most commonly the lower extremity, that fail to heal with normal wound care. Therefore, improving wound care for these critical patient population could significantly improve outcomes. Sometimes these chronic wounds even lead to amputation. Negative pressure wound therapy is one mechanism of wound therapy that has been around for many years. However, exactly how negative pressure wound therapy helps and exactly how it helps in diabetic wound healing has not been known. In this study, the authors examined how negative pressure wound therapy changed diabetic wounds over time, and they found two important and exciting findings. First, negative pressure wound therapy increased the number of lymphatic vessels in and around the wound. Lymphatics play an important role in wound healing as they control the appropriate fluid balance. Too much fluid and you get swelling or edema and poor wound healing. So new lymphatics allow appropriate fluid balance within the wound. Second, the authors saw increased number of blood vessels. This would allow nutrients to flow to and from the wound, therefore also improving wound healing. Excitingly, the authors found that as early as 10 days after initiating negative pressure wound therapy, there was a significant number of improved lymphatic vessels, and that these lymphatic vessels were functioning, helping fluid flow to and from the wound. This exciting paper, hopefully, will change the way that we think about treating these chronic diabetic wounds that can have such an impact on a fragile patient population.